Hello, Clinic Review family. It's Dr. Sharon with Clinic Reviews. Today we're talking about idiopathic thrombocytopenic purpura. I know that sounds so exciting. So let's go ahead and get started. Hello, my friends. It's Dr. Sharon with Clinic Reviews, the home of the very best Nclex review in the entire universe. So you can go to clinicreviews.com and get a 21 plus hour online on demand Nclex review from the GOAT himself, Mark Klimek. And you can also do small group tutoring. It's a package of 4 sessions. I do 2 of them. You can also get our streaming service. So you know this channel is a part of the greater Clinic Review organization. Our primary goal is to help you pass Nclex, but we also can help you pass standardized tests related to LPN or RN programs that you might be in. Today, we are going to be covering another topic from the Blue Book. The Blue Book is what Mark Klimek himself published. It's really just a book of facts that you have to know. So people say, what do I have to know for the Nclex? Well, this Blue Book is part of what you have to know. So I recommend going to Amazon and Googling Blue Book Klimek. I don't make any money from it, so I can tell you about it and not feel guilty. So let's go ahead. You know, when I teach from the Blue Book that I use questions to teach the content. So let's go ahead and get started. Which laboratory finding is expected in a client with idiopathic thrombocytopenic purpura? Increased platelet count, decreased hemoglobin and hematocrit, prolonged prothrombin time, or decreased platelet count. So thrombocytopenia is a vocabulary word that you must know. It means low platelet count. Do you know what the word idiopathic means? It means no known reason. Idiopathic, anything that's idiopathic, we don't know why it's happening. Purpura has to do with the purple bruises that they get on their skin. So it's idiopathic thrombocytopenic purpura. Which of the following statements about the pathophysiology of idiopathic thrombocytopenic purpura is correct? It is caused by a deficiency of clotting factors. It results from platelet destruction by autoantibodies. It is caused by a bacterial infection that affects platelet production. It is an inherited disorder leading to decreased platelet synthesis. So we don't know what causes it. So A cannot be correct, C cannot be correct. And we probably would not call it idiopathic if it was inherited. It is actually considered an autoimmune disorder. In other words, a person's immune system attacks their platelets to destroy them. And they don't know why it happens. They sort of treat it like other autoimmune disorders where they try to suppress the immune system, but they don't really know why it happens. A nurse is assessing a client with ITP. Which of the following findings is most concerning? Petechiae on the arms and legs, ecchymosis on the trunk, hematuria, or fatigue. So remember, in the name of the disease is purpura. Purpura tells us there are purple bruises on the body. So we're always most concerned about unexpected findings. This is one of the prioritization strategies that I've taught you. When you have one patient in the question and they give you a diagnosis, and then all the assessment findings are in the answers, and they say, which are you most concerned about? You're always most concerned about the unexpected findings. So I would say A and B are expected. That's why it has the name that word purpura in the title. Now, the question is, would I expect hematuria or fatigue? Well, hematuria is bleeding more internally. So that's not really expected. Now, the question is fatigue expected? I don't necessarily say that fatigue is a specific symptom of ITP. However, fatigue is an extremely vague symptom. I would say fatigue is probably one of the most common symptoms of just about anything. You're going to be fatigued if you get a cold or a flu, or you get anything going on, right? Any problem, you're about ready to get fatigued. So fatigue is an extremely vague symptom, and I can't really say it's something I have to be concerned about. So if I say, am I more concerned about blood in the urine or about fatigue? I have to say blood in the urine. So could it be an expected finding? I mean, if they go through and they find that their platelet count is like 5,000, I mean, they may go, okay, hematuria may be expected, but it's not an expected symptom of the disease. It's more of a complication. When your platelet count gets so low, you can start bleeding from other places, right? So sort of the expected finding is bruising around the body. That's what petechiae and ecchymosis are. Petechiae are small pinpoint bruises. The nurse is preparing to administer medication to a client with ITP, which medication is most likely to be prescribed to increase platelet count: warfarin, heparin, aspirin, or prednisone. So if I don't know the answer to this question, I might say, well, the first thing I'm looking for is something that directly increases platelet count. Like, is there a med I can give to increase platelet count? And there really is not a med I can give to increase platelet count. So then the question is, well, why are the platelets being destroyed? The platelets are being destroyed because it's an autoimmune disorder. And so can any of these medications suppress the immune system? And the answer is prednisone actually does suppress the immune system. Prednisone is a steroid, and it suppresses the immune system, and it is a stress hormone. So when people make too much stress hormone, that's called Cushing's syndrome. It's an overproduction from the adrenal cortex. It's called Cushing's syndrome. That's when the body makes too much stress hormone. But when we give stress hormones like prednisone, you can long-term get some of the symptoms of that, like osteoporosis, moon face, increased risk of infection, and so forth, because it is an immunosuppressant. So by suppressing the immune system, we hope that we can increase platelet count by preventing the breakdown of the platelets. A nurse is educating a client with ITP about home care. Which statement by the client indicates a need for further teaching? I will use a soft bristled toothbrush. I will take ibuprofen if I have a headache. I will avoid contact sports. I will wear shoes when walking outside. All right, further teaching. So that means a false statement. So they have low platelets, which means they're at risk for bleeding. That's why they have the bruising on their body. So they're at risk for bleeding. So we're looking for the false statement. I'll use a soft bristled toothbrush. Well, that's a good thing to do. I will take ibuprofen if I have a headache. That's not a good thing to do. Ibuprofen can increase bleeding. I will avoid contact sports. That's a good thing to do if you want to prevent bleeding. I will wear shoes when walking outside. That's a good thing so you don't step on something and start to bleed out. So the only false statement, or the one that needs correction, is B. I will take ibuprofen. I would say the same if I said I'll take aspirin. They shouldn't take that. I would say the only thing they can really take for pain is acetaminophen or Tylenol. That would be the preferred option if they have a headache or aches and pains. A client with ITP is receiving IV immunoglobulin. What is the primary purpose of this treatment? To increase platelet production, to suppress the immune response, to stimulate bone marrow production, or to enhance blood clotting? Well, I know it doesn't stimulate bone marrow function and it doesn't enhance blood clotting, so I'm going to cross those out. So obviously, if we're treating ITP, we want to increase platelet count, but we also know that we need to suppress the immune response. So I'm just telling you how to kind of guess if you don't know automatically what the answer is. And in fact, giving IV immunoglobulins actually suppress the immune response. So you do want to see increased platelet count, but it doesn't increase platelet production. Okay. So production is not increased. There's really no way we can increase platelet production. We can just prevent the breakdown of the platelets. So IVGs are given, IV immunoglobulins are given to suppress the immune system, just like prednisone is. Which signs and symptoms are commonly associated with idiopathic thrombocytopenic purpura? Select all that apply: petechiae, fatigue, joint pain, ecchymosis, and hypertension. So we know that the petechiae and the ecchymosis are going to be true. The word purpura helps us with that because that's purple, bruising. So we're going to pick the ones that are bruising. So we're going to pick A and D. Fatigue, that's a very vague symptom, and it's often associated with things. So it's sort of a good guess to pick it. Joint pain. Well, platelets are produced in the bone marrow. So you might say, oh, well, it could be joint pain, but this isn't about production of platelets. Platelets are being produced just fine. They're not overproduced. They're not underproduced. The problem is they're being destroyed by an autoimmune response. So joint pain would not be expected. Hypertension, there's no reason to think platelet count affects blood pressure. So we're going to go ahead and pick A, B, and D. So when you don't know, like if like in this case, you might go, oh yeah, I know the right answer to this. Good, good. I'm glad you do. I hope you do. But if you don't know, just reason through it, use common sense, make sure that you understand the pathophysiology or the etiology of the disease. The nurse is teaching a client with ITP about bleeding precautions, which statement indicates understanding. I will use an electric razor instead of a blade. I will take aspirin for mild pain. I will play soccer with my friends. I will avoid green leafy vegetables. So ITP, they're at risk for bleeding. So which is correct? So it is correct to use an electric razor instead of a blade. An electric razor is less likely to cause cuts. So the A is good. Aspirin, no. I would say Tylenol, yes, but aspirin is out. It's an antiplatelet. Play soccer, that's a contact sport. I wouldn't recommend that. Avoid green leafy vegetables. So green leafy vegetables increase your clotting. They increase your clotting. So that's why when someone's on warfarin, we tell them to eat a consistent diet of green leafy vegetables, because if they're taking a medication to slow clotting, and then they start eating a lot of green leafy vegetables or an inconsistent amount of green leafy vegetables, their clotting times are going to go all up and down. So for someone who is at risk for bleeding, actually eating green leafy vegetables will slow clotting. Will speed up clotting. It may not always do that, but it would be more likely to speed up clotting. So it would clot faster than slower. So it's actually not a good idea to avoid green leafy vegetables. So I like the option of using an electric razor rather than a blade. Which interventions are recommended for severe idiopathic thrombocytopenic purpura? Platelet transfusion, corticosteroids, IV immunoglobulins, splenectomy, thrombolytic therapy, or chemotherapy. So this isn't cancer. We do use chemotherapy for things that aren't cancer sometimes, but in this case, we're not going to use chemotherapy. Thrombolytic therapy breaks up clots. We certainly don't want to do that. Platelets are broken down in the spleen. They actually will do a splenectomy for severe idiopathic thrombocytopenic purpura. So they can remove the spleen because that's where they're broken down. If you prevent them from being broken down, your platelet count's going to go up. So that's actually true. We already know IV immunoglobulins suppress the immune system, corticosteroids suppress the immune system. Those are good things. So platelet transfusion. So platelet transfusion, I'm saying yes. It says in the blue book, it says platelet transfusion is used. Now, if you look it up, you're going to find that they will say platelet transfusion is usually only used if they're bleeding. So in other words, if they have a low platelet count and they start bleeding, giving a platelet transfusion can be helpful for stopping the bleeding. But they'll also say that if you give platelets to someone who has ITP and you haven't done a splenectomy, those platelets are just going to get destroyed if you give them. So it is true that we use platelet transfusions with ITP, but usually it's associated with actively bleeding. Okay. But it is used with severe ITP. Which of the following is the most common cause of death in untreated idiopathic thrombocytopenic purpura? Well, I would think it would be something related to bleeding. So let's see. Respiratory failure, that's not bleeding. Cardiac arrest, that's not bleeding. Intracranial hemorrhage, that's bleeding. Kidney failure, that's not bleeding. So since it's a bleeding problem, I'm going to pick the bleeding complication. So that's the correct answer. A client with ITP is scheduled for a splenectomy. The nurse knows that which post-op order is the highest priority. Administer pain med as prescribed, monitor for signs of infection, assess for sudden onset of abdominal distension and hypotension, encourage ambulation to prevent pneumonia. So whenever I do priorities, highest priorities, I tend to look for objective problems, physiological objective problems that are life-threatening. Okay, so that's what I try to look for. So pain is not life-threatening and it's not objective, it's subjective. So I'm gonna leave that off the list until I look at the other ones, unless the other ones are all bad. Monitor for signs of infection. So I go, well, that's true. I do want to monitor for signs of infection, but infection rates after surgeries, when surgeries are done correctly, are very low, very, very low. So that's not a high risk. So maybe, but it's not a high risk, except for sudden onset abdominal distension and hypotension. So it's an abdominal surgery and their platelet counts are low, so they're at risk for bleeding. And it's a high risk for bleeding, y'all. So it seems like abdominal bleeding, which could be indicated, abdominal bleeding could be indicated by abdominal distension and hypotension if they're bleeding out in their belly. That seems like not only a high risk, but it's life-threatening. So I like C, encourage ambulation to prevent pneumonia. Well, that's fine. I do want to prevent pneumonia, but pneumonia is less likely than bleeding. And in this case, severe hemorrhage after a splenectomy, which is really a pretty good risk, high risk, is something that I really need to watch for. So it's both likely and life-threatening. A nurse is caring for a pregnant client with ITP who's 37 weeks gestation, which assessment finding is the highest priority. Well, ITP is all about bleeding. So I would think it would have something to do with bleeding. Mild ankle edema, that's not bleeding. Uterine contractions every 10 minutes. So the highest priority is something that's unexpected. And actually, she's 37 weeks gestation, which is full term. So I'm not really that concerned about contractions every 10 minutes. Petechiae in the arms and legs. That's expected with ITP. Like that's one of the most common symptoms. So that's expected. Sudden onset of severe abdominal pain. Well, that's a problem. I don't expect that. Contractions are not described as sudden onset severe abdominal pain. They're described as uterine contraction. Like B is how they would describe it. Okay. So D is definitely unexpected. Is probably abruptio placenta, although it's not, I don't have to say that it is. That's probably what it is. And I am very concerned about bleeding out. So that's the one I'm most concerned about. So I'm most concerned about the unexpected finding. A, B, and C are all expected. The nurse is caring for a client with ITP who's been receiving corticosteroids for several months. Which assessment finding is most concerning? Again, unexpected. Fever and productive cough. Well, that's unexpected. Weight gain and moon face. That's expected with prednisone. Increased blood glucose levels. That's also expected with prednisone. It's a glucocorticoid. Mild bruising on the forearms. Well, that's expected with ITP. So B, C, and D are all expected in this scenario, whereas A is unexpected. Now, remember, it does suppress the immune system. So the reason we're concerned about that is because when you have a suppressed immune system and then you have signs and symptoms of infection, it has to be reported. A client with ITP reports severe fatigue and dizziness upon standing. The nurse's first action should be to do what? So ITP, severe fatigue and dizziness. So I don't like the word severe. So fatigue might be expected, dizziness is not, and severe fatigue is not expected. So these are unexpected findings. So what should be the first action? Assess the client's blood pressure and heart rate. That seems like a good idea, especially with the dizziness. Encourage the client to rest and drink fluids. I don't think that would be the first thing I would do with fatigue and dizziness. Notify the healthcare provider immediately. Maybe document the findings, continue to monitor. So B and D are out. All right. So first, would I want to assess the blood pressure and heart rate and then notify the healthcare provider, or notify the healthcare provider and then assess the blood pressure and heart rate? Well, I need to assess the blood pressure and heart rate first, obviously. All right. The nurse is caring for a client with ITP who has a platelet count of 18,000, which assessment finding requires immediate intervention. So 18,000 is very low. Normal is 150,000 to 400,000. So this is extremely low. So which requires immediate intervention? So unexpected findings require immediate intervention. Large ecchymosis on the upper arms. Well, that's pretty expected with that low of a platelet count. New onset confusion and headache. Well, that's not expected. There's no reason why that would be expected with a low platelet count. Mild oozing of blood from the gums. Y'all, your platelet count is that low. That's expected. Petechiae in the lower extremities, again, expected. So all the bleeding, the kind of mild bleeding and typical bleeding stuff is expected, but confusion and headache is not expected. Now you might go, well, are they hemorrhaging? Like, are they having a brain bleed? They could be, but as nurses, they don't expect us to diagnose problems, right? That's not our role. we are not trained to diagnose. What they expect us to be able to identify is unexpected findings so that we can do the right thing when we find unexpected findings. We can take action and be aggressive with that. So they're not asking, although it probably is a hemorrhage, that's not even what they're asking. They're just like, can you identify the unexpected findings? That's why it's really, really important for you to understand this prioritization strategy. You are definitely going to get more than a handful of questions asking you questions exactly in this way, because they want to know if you can think clinically, reason through the scenario and go, oh, that's the one I'm most concerned about. All right. So that's it. And I hope that was helpful to you. And I don't know what else to say. You know, I just got back from Malawi, East Africa. If you are from the continent of Africa, you have a beautiful continent. I love going there and I had a wonderful time. So thank you if you live in Malawi or one of the close countries. Thank you for welcoming me to the warm heart of Africa. And I will see you later. Have a great rest of your day.